Hello, and welcome to our podcast. I'm Dani, and today Great.com talks with Nitombi Michizi, the CEO of AIDS Foundation South Africa. If you haven't heard of them, they work to empower communities to participate in ending AIDS as a public health threat and improve health and wellness. Before we begin, remember, if you're new here to this podcast, press subscribe on YouTube or in your podcast app. Now, hi Nitombi, and welcome.
Hi, Danielle. Thank you for having me.
It's a pleasure. It's a pleasure. We really want to know more about the work that you're doing right now. But your history began in 1988, right? It's been a long journey for your organization. So could you tell us about how did it begin and what has changed ever since?
Yes, thank you. I always joke and say the organization is almost as old as I am because that should give you a sense of of how old I am, but also I think an indication of how long we've been in this space doing the work that we are doing. So we are at the core of our work a non-governmental organization. We are based in South Africa, and we were registered as one of the first non-governmental organizations in this country that were focusing on the fight against HIV and AIDS, which is why we have the AIDS domain if you look at our website. And really, the focus was to support some of the initiatives that were already there by the government to try and eradicate HIV and AIDS, especially the spiking and escalating cases that we're seeing, around those times. And so, really, the organization was formed to support those efforts. And we started as a really small organization operating out of Cape Town. And as the need grew in the country, and there were fortunately some resources allocated, the organization was able to expand. So even though we started in one city at the moment, we now are working in majority of the provinces in the country, where we are implementing various HIV and AIDS program, focusing on various populations. So from adolescent girls, adolescent boys, young men, young women. We are also working with sex workers, and we do a lot of work around human rights and advocacy because we just want to make sure that there's a comprehensive approach into the work that we do. Where we're saying we're advocating for access to to treatment, but also making sure that there are facilities that are available to then receive people when we've done all the advocacy in the community. So we're really a community organization at the core, of who we are, really trying to, strengthen systems by ensuring that we work as a bridge between the communities as well as the health system, but particularly focusing on HIV and AIDS.
I think you kind of pointed to some perspectives already, but I would like to learn more about the challenges that these communities are facing right now. A lot has changed ever since 1998. I think we have advanced in treatment, in the way that we also see AIDS as more of a public health issue. But what are these challenges that your communities are facing now, like in the day-to-day basis?
Thanks, Danielle. So, in terms of the challenges, there is a lot of progress that has been, made from, around the, 70s, 80s, when we were all learning about, HIV and the cases that we are seeing. But the reality is that for sub-Saharan Africa, we remain the epicenter for, HIV, and particularly in South Africa. So that does mean that there is still a considerable amount of work that we need to do to make sure that we're able to support communities. So in our approach, really, we look at two things because there's issues where we want to focus on ensuring that there is prevention of HIV, so that for those who have not contracted remain negative, but also there is a component that focuses on on treatment, to make sure that then those who have tested positive are then have access to treatment. So, essentially, then the work that we do is really focusing on a lot of that, really going from community to, community. So we work quite closely with the different communities that we support, the volunteers from the different communities where we support, where we literally have those field workers, going door to door, because what we are wanting, to make sure is that, we are able to meet with individuals, we are able to, to meet with families so that we can have this discussion, but also then discuss what the options are available for different people, because sometimes, a lot of focus is shifted around what treatment is available for HIV, but not so much about, for people who want to remain negative. So there is, for instance, PrEP, now, but there aren't actually a lot of people that know about PrEP. And I mean, if you look at the burden of HIV, particularly in the South African context, there's a lot of burden that's sitting, amongst adolescent girls and young women. And those also are people who are, sexually active. And so it's looking at that to say, either we try to delay sexual debut, but if you're already sexually active, what are some of the options that are available to you so that you are able to, protect yourself and maintain your negative status. So I guess really, but the concern has been around the fact that with this key, particular group, this is where we've seen, the burden. And so the question also has been, what else can we then do to really support, this population, whether HIV positive or, negative, depending on where we meet them in their lives.
Well, thank you for this perspective. I think it's something that I personally did not know. So really, thank you.
Yeah.
And moving from this to the programs that you have, could you
Yeah.
tell us with more detail about what are you guys doing right now? What is the kind of help that you can provide?
Sure. Yeah, so there is, we used a two-pronged approach in doing our work. One, because as a community partner, we do feel comfortable in working in the different communities that we work in. As I said, for instance, if you look at our programs, a lot of the staff that we employ belongs to those communities, because we want to make sure that, there's respect, there's, understanding of the cultural context in general, community dynamics. And so we have two types of programs. So we have those programs where we do what is called direct implementation. So where you would have Ntombi going to someone's house, introducing themselves and, providing the necessary services, whether it's providing counseling, whether it's providing just, general sensitization around, HIV. If there's a need for a referral to a local health facility, we do that. We also have mobile clinics that do go to these, communities where if people are unable to get to facilities, the mobile clinics go to the community where they get tested. But in all of that, we work quite closely, with the local facilities, with the local, department of health as well. So that's one thing that is quite key, to us, is make sure that the work that we do is aligned, to the priorities of the government as well. So that would be the one approach. But the other key thing that we always look at is long-term sustainability of this program. So you can't just have the AIDS Foundation only implementing those programs. So one of the things that we've looked at is capacitating of community partners. So instead of then having the staff from the AIDS Foundation going to, implement these programs directly, we actually work with the various community structures, various community civil society sectors, where we identify, active organizations within those various communities, and we then provide them all the necessary, training to, because we want to make sure that when we transition out of these communities, because the reality is that we're dependent on, funding. If the funders come back and say, we are unable to do this, there must have been some capacity that is provided to, to the community. And so to that extent, what we then do is, once this organization have been identified, we really provide both, technical, assistance, as well as administrative support, where, something as simple as, if you have an organization, it needs to be registered in the country, because otherwise, if it's not registered, it means you cannot get access to other resources that may be available. So that's something that maybe you and I could take, for granted, but for a very small community-based organization, it might not be that obvious, nor that simple. So that's literally where we start to say, are you registered? Do you have a structure? Do you have a board? How do you exercise oversight? Because the idea is that even if we are not here, you'll be able to, apply for funding or resources, and, funders will only look at you if they feel like you have the potential or you have the basic minimum requirements in place. And that is exactly what we try to put in place with this organization. So there's that, which is the administrative bit. And then there is what we then refer to as the technical support. The technical support is more around, how do you run a program? Now you've received 1 million rand. You've never received this amount of money. How do you implement that? How do you design a budget? Something that might seem very simple. How do you develop a budget and make sure that you have activities that are aligned to the budget? But also, how do you report this expenditure, back to the funder? So it's all those things. Just making sure that from a governance and compliance perspective, there's a really solid foundation, so that there's hopefully more opportunities for this organization to be able to access other resources, and not, just from the AIDS Foundation. So that's essentially what we do. And I think to date we've trained more than 150 smaller community-based organizations, and I think we've had some really great, success stories where others are saying, I'm grateful for the support. It's been quite difficult at the beginning, but I've been able to access other funds and been able to grow the organization, support, or rather increase the support in the community. So that's the balance that we try to strike, to say, whilst we're able to do some of the work, we can't get everywhere as well. That's the reality. So work closely as well with the community partners, excuse me, to make sure that you're really able to expand your reach in the different communities that we work in. Thanks.
Oh, this is huge actually. I'm thinking here, this is one amazing to see how far can you actually extend this help, because it's not just like primary care, right? It's about thinking, as you said, sustainable,
Mm,
a sustainable future. And with that,
yeah.
I kind of want to ask you about partnerships. That seems like a vital thing. You mentioned that you work closely with the government, you work close to the communities. Could you talk more about the importance, and how you make these connections happen?
So yeah, so funny enough, the theme for World AIDS Day last year was "Let Communities Lead," because really there's this emphasis to say we should not be coming to communities to impose what we think is important, what we think is a priority, for the organization. For us to be able to understand the needs and and priorities of the communities, we need to to be able to work hand in hand together. So one of the great things about South Africa is that it has a really well coordinated, HIV response. There are a number of civil society sectors that represent, different sectors, and these are not really just presented at a national level, but it really comes, from a community level. And I think because from when we started, around the late 80s, there was a lot of work that was being done with these structures. So naturally it feels like we've really become part of these communities, where if there is a program that is going to start in a certain community, so generally we would then consult these structures to say, this is what we want to do, this is the kind of work that we want to do, who are the the partners that we could potentially work with. And how that works really well is that now, because you might have a general program that says you want to do HIV testing and whatnot, but maybe not really understanding the dynamics, of that community. But it means if you have a local partner, you have someone who's able to introduce you to, to the gatekeepers, so that you're able to get buy-in to, access the community. But also if you're having difficulty, it means these are the very same structures that can support you to say, we recognize this organization, this is the work that they do, this is credible work. Because unfortunately, also we have organizations just starting things and then disappearing. And so, communities have, have become a little, unsure sometimes, of their, intentions. This is why, for us, for credibility, as well, it's important that we work with these various structures in identifying, the different partner, even to a point where sometimes, in program design, as I said, it's not just government. It's yes, it's the various provincial offices, but also these structures to say, does this kind of thing make sense, but also largely guided by some of the data that comes from the work that we are currently implementing, where we're able to say, actually, in reality, this is what the data, is telling us about, the trend, therefore, this is why we are suggesting, but we want that corroboration from the community so that we know also that we are, on track as well.
Yeah, I think that's all part of that balance that you mentioned before, right? Managing
Absolutely.
this sort of
Yeah.
data, for instance. And now, Nitomi, thinking about the future, what are the next steps for you guys, like in the near future?
So, in terms of I mean, it's not so much as the next step. We have a 5-year strategy that guides us as an organization. But one thing that we've been intentional about is that we make sure that our strategy is aligned to the South Africa's National Strategic Plan, because we want to make sure that we are aligned to the government's priorities, the country's priorities, actually, where, the country's not saying, this is the priority and the AIDS Foundation is sort of going its own direction. So I think what's quite nice is that our own strategy really, is aligned to that, as well as the UNAIDS strategy, the 95-95 strategy, where, we're saying by 2030 we want to make sure that 95%, of people know their status, and that of those that know their status, 95% should be on treatment, and then the last 95 being there to those who are on treatment must be virally suppressed. And that really, essentially underlines, the work that we do and the programs that we design. As I said, we are really also guided by, the data, because we've been implementing for the last 35, 36 years. And so we also rely on this data, that we're getting from the different communities to say, this is because, a pandemic is not static, it evolves. And so as a partner, to some extent, you need to be able to be, flexible as well, so that you can be responsive to, to the needs of the community. And so this is why, I say we use largely the data as the compass that guides um, our work. And so a lot of our programs really, focus on, ensuring that, there's prevention, but, where then, the different people that we work with or our key pops have, tested positive, then the focus becomes on treatment, but with an underlying component of psychosocial support, which is becoming more and more, increasing, regardless of the status of your HIV, the mental health issue is becoming like a really, big one. And I'm glad that people are really starting to talk about it, but I don't think we're doing enough. And so one of the things that we are really trying to integrate into our program is the psychosocial support component, where we're able to provide any kind of, support, counseling that might be required for the different communities that we work with.
It's really wonderful, and I think this is really important next step to take. Nitombi, what are the best ways for listeners that want to get involved with you guys, help you keep going?
So there are various ways that we can be supported by, and we always appreciate the support. As I said, that we are a non-governmental organization, so we largely rely on donations to carry out all the work that I spoke about earlier. So one of the things that we look into is getting volunteers who are able to support us in the different communities that we work with. That is always essential, because it means getting volunteers from those communities means getting people who understand the communities, the dynamics, as well as, its various context. But, with that as well, earlier I spoke about mobile clinics. A lot of the work that we do is based in rural communities. So we require mobile clinics, and, these require fuel. Unfortunately, also as an NGO, we are impacted by, the economy, the inflation. So we generally, would then require, costs to cover, maintenance of this mobile clinic. I mean, sometimes these mobile clinics, would even break down. So, any support towards this mobile clinic or running costs, for this clinics, things such as, fuel or maintenance, general maintenance, but also any kind of donations, because there's also the running cost for the organization, which sometimes, funders would say, I'm going to pay for the program, but 95% for it, needs to go to direct program cost and only 5% for overheads. But the reality is you need people to run the program. You need to pay for rent, you need to pay for lights, so those kind of things we are seeing that they're coming few and far, in between. And so being able to get, donations, for instance, are able to really make sure that they keep the lights on while we focus on making sure that we're able to provide services to communities. Thank you.
Perfect. And thank you. Thank you so much, Nitombi, for joining us today. I learned a lot and this was a great conversation. Thank you.
All right. Thank you so much, Danielle.
And for everyone listening to us right now, thank you so much for staying with us for one more episode. And remember, if you enjoyed this episode, press subscribe on YouTube or on your podcast app, because that shows the algorithms that this is an important conversation and more people can learn about the importance of the AIDS Foundation in South Africa. Bye, and I'll see you in the next episode.